ASU experts say that we are once again in a surge. Do you agree? And if so, what does that really mean?
So we are seeing an increase in our cases, in our rates, and our percent positivity. So we had been staying relatively flat. So we are starting to see that increase. And the department, we are concerned and we are watching those numbers, but we know that we're in a much different place than we were back in May and June.
Looking at the past 7 months, what did we do well and what are we doing differently now to better prepare?
So I think Arizonans have done a really great job at wearing the masks when they're out in public, staying home when they're sick, and physically distancing. So keeping 6 feet between you and people who aren't in your household. I think we also learned that implementing those mitigation requirements at restaurants and bars and gyms and movie theaters all played a big role in reducing the spread. And all of those are still intact. And we've been working to ensure compliance with those requirements as well.
Anything that stands out to you that in particular you guys are doing differently as we plan?
So we are definitely trying to get the message out that now is not the time to let your guard down. You want to make sure that you're wearing a mask. We know everyone's tired of that. But we also have seen that, small household gatherings now, we're seeing more of those as transmission risk. And so, even if you're at a loved one's house or a friend's house that you feel is safe, it's still a good idea to maintain that physical distancing and wear a mask.
Do you see schools going back online before the end of the year? And a follow-up to that, in the past you've said that you are comfortable sending your kids to school. Do you still maintain that it is a safe place for your own children to be?
So we work very closely, especially our local health departments work very closely with the schools to help them with recommendations so that if they get cases in their schools, they can make good decisions that can hopefully keep children in-person learning, because we know how important that is. Schools have done a great job working with public health, and the parents have done a really great job at following the recommendations. We know that it is frustrating when you are asked to have your child out for 14 days, even though they're not sick, because they may have been a close contact. My children are currently in school. I feel very safe with them there, but I also know that now I have a potential risk of transmission. My children could bring it home. That is why you will always find me wearing a mask when I am around people who are not in my household.
If you had to give health experts in Arizona a grade on how you guys have handled the pandemic, what grade letter would you give?
I would give us probably a C, maybe, looking at, how we were able to anticipate, I think, but I would give us an A in the overall effort and response that the team has been continuously working. And as we've learned, we've applied those things for moving forward.
What plans do we have right now to help slow outbreaks in nursing homes this time around?
So we are working with our nursing home associations, our nursing home, and our CMS surveyors to provide on-site technical assistance to make sure that we are responding once they get a case. And we're working with our federal partners that we are getting information from CMS and from our federal partners in order to be able to target those facilities that may be at high risk and get in there to provide them the technical assistance and the support they need.
If the trends continue, is there potential to stop that visitor policy?
So the visitor policy changes depending on what spread category you're in. So if you're in a substantial, the visitors are significantly limited without testing. And then the visitor restrictions ease as you get into moderate and then into minimal. So it will modulate based on where that county is. Most of our counties are in a moderate with one county in minimal. That's not going to change this week. And so, really making sure that visitors are adhering to the testing policies, that they're maintaining that distance, even though we know that it's been a long, hard road waiting to see your loved one. But we really do need to take those steps to keep them safe.
What is the biggest issue that's keeping you up at night right now when it comes to the pandemic?
So I think that right now I'm trying to make sure that we get the message out. I am concerned about Thanksgiving. I anticipate, we're seeing increased cases. We know that the high demographic is going to come back and have dinner, and we anticipate seeing a significant increase 10 to 14 days after Thanksgiving. So really reminding people, we know that they are tired and frustrated with wearing the masks, having to stay away from their loved ones, not being able to visit people in long-term care. But we're encouraging everybody to keep it up. They've been doing such a great job, and we really want to keep these numbers as low as possible.